Good afternoon, everyone. Thank you all for joining us for this virtual town hall. We have an impressive group of experts with us here today to talk about crisis services here in New Jersey and how you can help us ensure that nobody's worst day keeps them from living their best life. My name is Meredith Mason Blount, and I'm the CEO of NAMI New Jersey. NAMI New Jersey is an organization here in Jersey that offers education, support, system advocacy, and public awareness initiatives to help all of those affected by mental health challenges build better lives. May, of course, is Mental Health Awareness Month. And so members of New Jersey, the members of the New Jersey community deal with mental health challenges every day of every month of every year. And in May, we fight stigma to provide support, educate the public, and advocate for policies that support people with mental illness and their families. New Jersey has a mental health crisis, and a mental health crisis requires a mental health response. We have a proven approach to saving lives and delivering the support people need in these moments of mental health emergencies, and is called the 988 Crisis Continuum of Care. It is built on the premise that everyone should always have three things: someone to call, someone to respond, and a safe place to go for help. The Crisis Continuum of Care is a comprehensive approach to ensuring that people receive the holistic care they need, from the initial contact on 988 hotline to post-crisis support and even follow-up appointments. We need to fund the 988 Crisis Continuum of Care like the life-saving service that it is. Similar to 911, 988 is a public service available to any person with a cell phone to text, chat, or call. And a small minimal fee on phone lines should be applied to support these vital crisis services. 988 is connecting people to care and often resolving crises without further intervention. Without stable funding, we risk losing that service. And I'm very excited to engage some of our speakers here today. We are very grateful to Deputy Commissioner Valerie Mielke for joining us today. Deputy Commissioner Valerie Mielke is the Deputy Commissioner for Health and Human Services, overseeing the Division of Mental Health and Addiction Services, where she has led crucial work to invest in and expand New Jersey's crisis continuum of care. Deputy Commissioner, thank you so much for joining us today. Can you tell us a little bit about the 988 system from your perspective?
Yes, thank you so very much, Meredith. And I just want to acknowledge Senator Vitale for his presence here and his ongoing support at Inseparables, as well as NAMI, for having me here today. So the 988 system of care is an important one for New Jersey because it provides a way for individuals who are experiencing a mental illness, a crisis related to their mental illness, and or a crisis as it relates to their substance use disorder, a way to reach an individual 24 hours a day, 7 days a week, live for support. And so our 988 continuum, as you mentioned, includes someone to call, someone to respond, and somewhere safe to go. And so over these last few years, since 988 has rolled out, we have strengthened our infrastructure for our call centers. We currently have 4 call centers in the state of New Jersey, one of which operates 24 hours a day, 7 days a week. They have trained individuals who answer phones live to help to support individuals who are experiencing a crisis and or if their loved one is experiencing a crisis. One of the new services that we've rolled out is our mobile crisis outreach response teams, also known as MCORTs. And we rolled that out this year. And so with that service, when individuals call the 3-digit number 988, If it's assessed that they could benefit from someone to come and meet with them where they are, it could be in their home, it could be, in a park, to meet with them to talk about the to help to resolve their issue and their crisis. As long as someone is not in an immediate crisis in terms of hurting themselves or others due to their mental illness, then we have a team that goes out to their homes. It includes an individual who has lived experience, as well as a bachelor's level staff person who will meet with them to talk about the crisis that's before them and work with them to help to mitigate that. And then we also have, in terms of a safe place to go, crisis receiving stabilization centers. So we've invested significant federal dollars to support our crisis receiving and stabilization centers. And with the 988 fee, it'll help to keep the service up and going on an regular basis.
Thank you so much for that amazing overview. So, Deputy Commissioner, some people in our audience might be wondering, so if all of that's already happening, why do we need dedicated 988 funding?
So the dedicated 988 funding will assure that we have a stable source of revenue to support the 988 system, which is just so crucial. Currently, we don't have resources to support the crisis receiving and stabilization centers, but to have a dedicated 988 fee, we know that all of the revenue that's generated from that fee goes to 988 to support the 988 system. It doesn't go anywhere else except to support the 988 system.
That's great. And just for our viewers to know that there are actually 11 other states who have already implemented the 988 fee to fund the crisis services in their state. And New Jersey absolutely should not fall behind when lives are on the line. So, Deputy Commissioner Melky, thank you so much for your time. We are going to also move over to Senator Vitale now. Senator Vitale serves as chairman of the Senate Health and Human Services Committee. He has been a tireless champion for mental health and is dedicated to improving access and care for all New Jerseyans. Senator Vitale.
Great, thank you. I've had some technical difficulties on my side and be considered to be a human walking computer virus. So I finally got this to work, and I appreciate the opportunity to present to you today and for all those on the call.
Wonderful. And thank you so much for your time.
Sure,
Senator Vitale, can you tell us why crisis services are important to you and why people should care about this issue?
Well, I'm going to give one example. This weekend, on my hometown is Woodbridge, and we celebrated Mental Health Awareness Month, and the mayor and his team here, the health department, held a really big program with lots of vendors at City Hall parking lot. There had to be a couple hundred people there overall, and visitors coming in and out, just citizens coming by. There's also the street fair that day, and so they really had a great crowd of people coming in and accessing all the vendors, all the information that was available. They also had a 988 booth, and there was a presentation during the program of someone who most recently accessed the 988 hotline. And she's a high school student that talked about her issues. Her certainly grateful that that number and the access to care was available to her. She'd experienced bullying for a number of years throughout school. She's now a senior. She's doing much better now that she's been able to access the care that she needs with her family. And so it's like a living, breathing example of why the 988 system matters. And so yesterday, when I was in Trenton, I introduced legislation that would dedicate or create the 40 cents per month per phone bill as a way to sustain the funding for this really important program. From beginning to end, as Commissioner Melky had articulated how important it is, what the money is being used for, the response teams, everything else that matters in terms of making this thing work. And so I'm hopeful that my colleagues will see it that way. I know that it was discussed by the commissioner during her comments to the budget committees in both the Senate and Assembly. And it seemed to get some good reaction, some good support. Certainly my colleagues and everyone who is, cares about this issue would be supportive. And so And I'm hopeful that it'll also be dedicated. As you know, only the funding that's constitutionally dedicated can actually be used for that purpose. And we'll make sure that, though, that if we get this bill passed and signed by the governor, that that money is accounted for every year, and it's spent. We know it will be spent wisely and for the right purpose. So that one example of that young woman who told her story was really powerful to the crowd. It sent a message to everybody else that's there who contemplating suicide, knows someone that might be contemplating suicide. And as you know, when that person calls, that's the most important phone call they'll ever make in their life. And at that moment is when you have the opportunity to help them and to save them. And so this is great. What you all are doing, everyone on this call who's involved in the process, whether it's our advocates, people on the ground, our friends in the department, and elsewhere, I can't be I'm prouder to be a part of this process and help you guys with whatever it is that you need.
Thank you so much, Senator. And one more quick question before we let you go to your busy day. You mentioned a little bit about the fee. Can you explain to our viewers today, why does it matter for a program like 988 to have a sustainable funding? What does that mean for New Jersey?
Well, it means that the services will always be available. It's not just a phone call. Can you make the phone call? And if there isn't anybody on the other side that is trained, that's available first, and it's trained to be able to help that person who makes the call, whether it's for themselves or someone else, and that the response team that particularly has to go out to see them, that's the opportunity to be able to do that, to prevent the crisis, to prevent some bad things from happening, that the money is there to support that. It doesn't happen any other way. And volunteers are volunteers, and they're terrific, but you really need a very thorough, sustainable system with all the resources that are necessary to help people. And volunteers are great, but it's not enough. And have the state backing this with their full force of the state, the money that goes along with it, will make all the difference in the world.
Thank you so much, Senator. Thank you for your dedication to mental health causes across New Jersey. And thank you for your time today.
That's my pleasure. Thanks, everybody. Have a great day.
Thank you. And our last speaker is Siobhan Power, the incoming board chair of the American Foundation for Suicide Prevention in New Jersey. Siobhan, we've heard a lot about how mental health crises need mental health responses, and I'm sure that seems like common sense to most people, but can you give us an example of what that actually looks like in real life?
Absolutely. Thank you, Meredith. I can tell you a little bit about my family's experience. So my husband has bipolar disorder, and he works very hard to manage it with medication and with therapy. And like many of you who are joining today and your loved ones, he does all of the right things. And still sometimes that isn't enough to manage his mental health. Sometimes he has a manic episode that is so severe, he needs a safe place outside our home to get stabilized. And this happened most recently in 2019, shortly after I gave birth to our daughter. At that time, before 988, and without a full crisis continuum of care here in New Jersey, we felt that we had no one to turn to other than local law enforcement to get him where he needed to be. And the officers who responded that day were not trained in a mental health crisis response, and they took him to the police station before taking him to the ER. I pleaded with them, newborn daughter in my arms, that what he needed was short-term hospitalization, and I explained that his symptoms were consistent with past manic episodes, and that he was under the care of a psychiatrist and taking his medication. Still, this was our experience, and it was a very difficult experience for all of us. I know that what happened to him may happen again, and it is happening to others throughout our state. And maybe it's happened to some of you here today or to your loved ones. I desperately hope that all future mental health crises in New Jersey receive a mental health response. It should not matter where in New Jersey you are at the time of a mental health crisis. Whether you are in rural Salem County or one of our densely populated cities, you and your loved ones deserve the same access to care. And this will only happen with a sustainably funded statewide system.
Siobhan, thank you so much for sharing your story. What we say in NAMI is that you are not alone, and I know that so many people listening and watching this right now can relate to your story. So thank you for sharing your story. And speaking of our audience, if they're listening to this now and believe everything that you shared and what we're saying, how can they what can they do right now? How can they get involved with this?
Sure. Right now, the single most effective way to make an impact is to contact your state legislators and say that you want to see the sustainable funding for crisis services included in this year's budget. And I do want to thank Senator Vitale, who joined us today, for introducing legislation that will ensure that this sustainable state funding stream exists.
That's excellent. Thank you so much, Siobhan. So thank you all to all of our great speakers today. And we're going to talk a little bit about what Siobhan said, our next steps. If you want to make a difference, please contact your legislator via a link in the event description. You will also be able to follow all of our great speakers and organizations on social media to receive real-time updates on this effort and how you can get involved. And all of those links are in the event description. We also have a social media toolkit with graphics and posts available to anyone who is excited and wanting to protect mental health in New Jersey. So you'll see the QR code right here. Please check out the link in the description and use the QR code which will be on your screen right now. And thank you for tuning into this town hall. And I will see if there's any questions in the chat before we close. Again, I would like to thank all of our speakers, Deputy Commissioner Valerie Melky, Senator Joe Vitale, and Siobhan Power from AFSP New Jersey. Thank you all for your help today. One question we have is, why do we need to contact the legislators? Do they not support the fee? Siobhan, would you like to take that question?
Sure. As many of you know, and I'm sure experiencing with your own spending, there has been a lot that's been proposed in this budget, and there are so many competing priorities. So one of the jobs of the state legislature is to determine which funding priorities need to remain in this budget. So the way that we can let them all know that this is a priority to our organizations and all of you joining today is to reach out to your local legislators and let them know that this is of the highest priority, and for less than the cost of a cup of coffee a year, we can make sure that we have this sustainable state funding source so that anyone who needs the care, and we understand that not everybody who calls into 988 requires an MCORT, and not everybody needs that crisis stabilization center, but we need to ensure that for every New Jersey resident who does, those are available and will continue to be available.
Wonderful. Thank you so much, Siobhan. And we have another question for Deputy Commissioner Valerie Melky. What actually happens when someone calls 988?
Yes, thank you. So when they call 988, if they're calling from a phone that has a New Jersey area code, that call will be routed to one of our 5 centers, contact centers, or the call centers. They're answered live by an individual, and that individual will begin to ask them questions and talk about, what's concerning them. Based on their responses, the person on the other end may ask permission to check in on that person in like a day or two to make sure that they're still okay and that they have the supports that they need. Or they may identify that, that maybe that the person needs a little bit more support than just telephonic. And again, if they agree, they will dispatch an MCORT team to them to talk more about what they're experiencing, to connect individuals to services, and then the MCORT teams will also follow up to make sure that that everything that they were connected to was helpful to them and that they don't need any additional resources. So it's all completely voluntary, and it's very much individualized. And the person on the other end of the phone is someone who is trained to be able to adequately support them. And as I mentioned earlier, this isn't just for someone who's experiencing a mental health crisis. This is also for individuals who are experiencing a substance use disorder as well. And we have found that as individuals, share what they're struggling with, they're connected to addiction treatment, they're connected to mental health treatment. And so it's really individualized based on the person's needs and interest.
That's wonderful. Thank you so much for walking us through that. As we close today, I just again want to thank Siobhan Power, Valerie Melky, and a special thanks to Senator Joe Vitale. So thank you so much for joining us today. And again, call your legislator, click the link in the chats, as well as go to the QR code and have tomorrow be our call to action that the legislators hear what we want, which is a full crisis continuum of care here in New Jersey. Thank you so much and have a wonderful day.